DeBar, England, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Tate, Turner Ford, Wiggins. We have a quorum.
We have three bills on the agenda to be followed by a presentation from Mr. Anderson dealing with child care. And it's just a general informational conversation that I hope to have, but there's much interest in that, and I think would do well to hear his perspective. But regarding the three bills, I thought we would go in reverse order because that just sort of seems the thing to do. So we'll start at the bottom with House Bill 3. This is what happened, which I think most of y'all know this. There was a certificate of need bill that we passed last year, which was to be effective from and after passage. The governor vetoed the bill because there was a provision to which he objected. As a result of that, none of the other features of this bill have gone into effect. So far as I know, they're all non-controversial. I had discussed this matter with Chairman Creekmore over the summer, and it was our idea that what we would do would be pass this bill as quickly as we possibly could so that we could get it to the governor's desk so that it could become law. The House, just a few minutes ago, passed the bill off their calendar and got immediate release. So that bill will be working its way here. It's not here yet because the message from the House has to physically get over here, has to be referred to committee and on and on. I doubt that's going to take place this afternoon. But what I would like for us to do is, assuming the House message gets over here and the bill gets referred to public health, we can prevail upon the Senate to let us have a committee meeting on the floor of the Senate tomorrow to report this bill out of committee. And then if we think well of it, take it up on the House, on the Senate floor and get it to the governor as quickly as we can so that A, we can get relief to these people. B, it's my intention to have one, if not two, additional certificate of need bills during this session, in particular, something dealing with rural hospitals. And there's some other matters, but primarily there's a focus on rural hospitals. But just as a matter of mechanics, if this bill is the law before we pass those bills, then we can conform all those bills to what will then be existing law, which is a long way of saying this is the same bill we passed last year. The House just passed it unanimously. I'm happy to review it, to discuss it. All of you have copies of the bill. And so it's time to look at it. And if you have questions, we can try to resolve those as time goes on. But that's the story on House Bill 3 and what it does and why it's here. If there are questions, I'll answer them. If not, I'll move backwards. Senator Hill.
On House Bill 3, the tightening language for the exemptions for the UMMC Medical Center Teaching Hospital, what has prompted the inclusion of some more restrictive language for them to have their academic exemption?
Well, I think that for all practical purposes, what's in the bill is the same thing we passed last year. I think the bill was to take effect on July 1st, or I'm sorry, it was the CON restriction was to take place, I think, July 1st last year. And I think in the bill that's coming from the House, it's from and after passage under the theory July 1st has long since passed.
Well, sometimes
yeah,
it
the-
takes me seeing something twice to ever figure out what it does.
So
But I guess the fact that, you know, UMMC has multiple satellite locations all over the state of Mississippi, my concern is with the language that says, as long as they do not undergo a physical relocation, but they have physical locations all over the place. So I'm not exactly sure what we're talking about a physical relocation. We know they're not moving the entire hospital anywhere, but they are
what
expanding.
line are we on?
Well, it's not, it's kind of in the middle of that paragraph. It's actually just in the summary in the middle of that paragraph where it talks about an academic exemption as long as they do not undergo a physical relocation.
This is a situation with University of Mississippi Medical exemption from CON. It does not exist explicitly in the law. A number of years ago, the State Department of Health decided they had an exemption for teaching purposes. The exemption historically, of course, applied to the hospital where they were. And there is the feeling among many people nowadays that although they teach everywhere, that their satellite facilities look a lot more like the sort of facilities hospitals would have for the purpose of increasing revenue, which is a fine thing to do. But that if the University of Mississippi Medical Center wishes to establish a hospital somewhere, they ought to go through the same certificate of need process that anyone else goes through. That they should not have a leg up in opening a hospital in DeSoto County or the Gulf Coast or any place else where there are already facilities. At the same time, we wanted to maintain their ability to maintain the core teaching function that they have at the hospital and indeed in that area around the hospital, which I think has a geographic definition on lines 1249 and following. But the idea was if the University of Mississippi Medical Center should have an exemption from the certificate of need law because it is a teaching hospital, that should apply to the area around the teaching hospital. And it should not extend to facilities they have in other places, which look a lot like facilities that other hospitals would have in those places. They can still have the facilities. They would just have to go through the certificate of need process that anyone else would. But it grandfathers in everything they've done.
Okay, I don't know that I'm a fan of certificate of need anyway, but I think you helped answer my question as to why the language is in here. Thank you.
Sure. If there are no other questions, we'll go to Senate Bill 2476. And I think Senator Hill is going to present that bill. Senator Hill.
Thank you, Mr. Chairman. This is a bill that's requested by the Board of Pharmacy. And what it would do is, and I don't even know if I have it here. I don't even see a copy of it. What it would basically do is allow someone who holds a pharmacy license to basically self-report if they have a substance abuse or mental health issue, to self-report and get treatment before any disciplinary action is taken. And the idea of this is to give them the opportunity to get help before it comes to the point to where they have to be disciplined and they've made some type of serious mistake. And I spoke to the Board of Pharmacy about this, and they said, of course, that they would not be able to practice after they self-reported until they got a clearance from whomever was treating them for what issue that they had. So that's basically what the bill does. It just gives them an opportunity before discipline to self-report and get some treatment, and not interrupt their working pathway as bad as it would if they were disciplined. So that's basically what the bill does, and I'll be happy to answer any questions. And I think Todd's here from the Board of Pharmacy if anybody has a question. This is the same pathway that the Board of Nursing uses, that we gave them a few years ago. And I think the physicians and dentists have some language in their code section that gives them leeway to do something similar. So that's the explanation of the bill.
Are there questions on the bill? Senator Turner Ford.
Thank you, Mr. Chairman. Is impairment defined anywhere in this particular section of the, maybe not in this bill, but the section of the code? And the reason I'm asking is based on line number 9.
On line number 9,
For licensees who have an impairment.
I don't see a definition of impairment, but I think what the bill's basically saying is if you have a substance abuse or mental health condition, that would constitute an impairment.
Further questions? Senator Wiggins.
Two questions real briefly. What is the process now in terms of, so somebody has to turn them in before there's a disciplinary proceeding? Is that right?
I think Todd would be able to potentially answer that question better than I can.
If you don't mind, I guess it'd be most convenient to go over to the podium so we can hear you, and please speak directly into the microphone because we've got this new improved sound system and you have to speak directly into the microphone.
On a memorandum, and then if they were not compliant with a memorandum, that it would go discipline. But this would just kind of give us similar abilities that the other health boards have. And we're hoping would lead to earlier reports versus people fearing for their livelihood or having a permanent, mark on their license, which would lead to some severe difficulty sometimes in getting employment.
Okay. So it's similar to a diversion program as we know it in the criminal side, and it says alternative to discipline. I just want to know what y'all understand that as. Does that mean if they do this, follow this, then they will not be disciplined?
They will.
Or does that mean that there is discipline, but it's less, or you can't lose your license or something?
Sure. There would not be discipline if they followed the constraints of the program with the Board of Pharmacy. If they had violated something that was a criminal act, something that needed to be reported to law enforcement, this would not protect them necessarily from that, but it would protect them from our board, issuing a due process hearing and putting discipline on their license. So if there's a action on someone's license, it has to be reported to the national database, and we commonly refer to that as discipline. So we're looking at professional discipline, this being an alternative to that.
Okay. So that's similar to what I guess on the criminal side is non-adjudication or something, which.
Correct.
Okay. Thank you very much.
Senator McMahon.
Yes, sir. Question. Thank you, Mr. Chairman, for the director. This bill does not name or require a number of times, but I hope that, or should we put in here how many times someone can self-report?
I don't think that's necessary. That's a good point. That's something that Senator Hill asked me earlier today. If someone comes into this on their first time, if they're not successful, if they're not compliant, it is going to flip to a disciplinary hearing. They're going to have discipline on their license. So I think it will self-correct without having that. But that's just my opinion on it. If they're not compliant with the program, it will proceed in a disciplinary hearing.
Okay. Thank you.
Anyone else? Questions? Debate? We ready to vote?
Thank you.
Senator Hill moves title sufficient do pass. All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. Senator Boyd has not been able to make it here yet. So, Mr. Anderson, since you were nice enough to come, would you want to come up to the podium and talk to us about childcare? And my understanding is the microphone has now been turned on. So that, but you still have to talk directly into the microphone, even though it's on, because we have this new improved sound system.
Thank you, Mr. Chairman. Appreciate the opportunity to be here. Just by way of a little bit of background concerning where we are with our child care program. As I have shared with this committee over the past couple of years, we received a significant amount of ARPA funding during the pandemic. And we used those funds in order to provide as many child care certificates as we could to families during the pandemic and afterwards. All of those ARPA funds expired. They were expended, I should say. They were gone. They were used up about April of last year. At the time that the ARPA funding expired, we were providing certificates to approximately 36,000 children in Mississippi. And just to remind the committee, a child care certificate or voucher, as it's also referred to, is a one-year certificate. And so all of those 36,000 children were enjoying a certificate for a year when those ARPA funds ran out. We requested of this body, the legislature last year, funding. We actually requested funding in the amount of $45 million, which we thought would be the amount needed in order to stay at the level of certificates that we were currently experiencing. The legislature provided us funding in the amount of $15 million in state funds. I should point out, most of our child care certificates are funded by Child Care Development Fund, federal funds. But the legislature provided us $15 million in child care funds in the way of general funds. And as we put those funds to work, we had to, back earlier in 2025, we had to put a pause in place because we did not have the funds to continue to award or to renew existing certificates or revalidate certificates that were expiring. So we ran into a funding shortfall. And as a result of that, we have now reached a waiting list of approximately 20,000. Is it families or children? It's families. 20,000 families are on our waiting list. We are serving again approximately 18,000 children with certificates right now. That's about half what we were serving at the peak of our ARPA funding. Utilizing that 15 million that was appropriated to us last year, we've been able to get back up to 18,000. And that's the background. First of all, we had been awarded, actually we were awarded $399 million in ARPA funding. We did a number of things primarily intended to do what that money was originally appropriated by Congress to do, and that is to keep childcare providers in business through the pandemic. And so we used that money not only for certificates, we used it for, I'll say, subsistence grants, assistance directly to childcare providers so that they could keep their businesses operating. We authorized them to do training. We put in place a child care employee substitute plan because a lot of child care providers, if they have an absence of one or two employees, they can't continue to stay open. They don't have enough teachers in the rooms in order to operate. The substitute teacher pool allows them to call on that substitute pool, get a person in a classroom, and be able to stay in operation. We did a number of those things with that ARPA funding toward the primary goal of supporting childcare providers so that they could continue to stay in business. We have about 1,500, is that right? Providers that are participating. Is that how many are participating? That's the total. All right. We have about 1,500 childcare providers across the state. About 1,100 of those participate in our childcare certificate program. We are thankful for the $15 million that the legislature provided us. Although I'm sure all of you have read, you probably heard from constituents, both in the form of childcare providers as well as parents, that there once again is a critical need for more childcare capacity. We have in our current budget request, we've asked you to continue forward with that 15 million that you gave us last year. But because of some other needs that we have as a result of HR 1 or some funding for some impact on the SNAP program, we did not ask for anything more than that 15 million that you gave us last year to continue to be funded. Now, I want to be very honest with you. If the legislature is inclined to fund childcare in a larger amount, whether it be 16 million, 20 million, 25 million, 45 million, whatever amount, we will devote those funds to providing certificates to those families and those children who are on our waiting list right now. We stopped the pause. What's the exact date we did that, Chad? All right. Mr. Chairman, I'm referring to Chad Allgood regularly. He's the division director for our Division of Early Childhood Care and Development. So back on November 18th, we raised what had been a pause in place for several months. And what we started doing at that time is renewing certificates that were up for renewal. Those were folks who were already in line, so to speak, and who were seeking renewals of their certificates. And we began accepting new applications, but those folks went on to a waiting list. Is that right? Let me clarify so I can get it right for the committee.
Hi, good afternoon. So effective November 18th, we re-implemented what we call redetermination. So any families that were currently receiving a child care certificate, instead of receiving a termination notice, they received a notice of redetermination that they could go in and requalify themselves to continue to receive benefits. We have families that roll on and roll off the program every single day. And so we watch those numbers daily. As we have additional space on the program, we then go to the waiting list. We start at the number at which a family has signed up. We give them a unique application link, and then that family can then go in and apply. So we're not removing any families from the program that are qualified at this point. And then as we have additional space, as families roll off, we are pulling new families from the waiting list.
All right, so that's what we're doing. There's been a lot of talk about what we could, should do with TANF funds with respect to childcare. Let me tell you first what we are currently doing. We are converting 30% of our TANF state assistance grant, 30%, which amounts to $25 million directly to the Child Care Development Fund. So we are already plugging, so to speak, our Child Care Development Fund grant with $25 million in TANF funds. As most of you, I think, know, we also provide to our sister agency, the Child Protection Service, $29 million in TANF funds each year. And we will continue to convert 30% of our TANF state assistance grant to childcare as long as there's a need. And for the foreseeable future, it looks like there is a need. So we will keep doing that. What I've been troubled by, and I know many of you have heard directly from some advocates for the childcare industry, is the notion that we should convert every TANF dollar that's available directly to childcare. We can't do that. We certainly can't do it in the context of converting it to CCDF funding. And the law is very clear that we can convert a maximum of 30% of the TANF grant to Child Care Development Fund dollars, and we are doing that. Does that mean we can't use any more of the TANF dollars for childcare? No, it does not mean that. But what it means is, first of all, we just finished 2 RFPs and we're in the process of sorting out how much TANF funding will be allocated to those RFP award recipients for programs that assist the child care programs, such as after-school programs and activities, which our TANF subgrantees provide in order for their children who are in school during the day to have a place to be involved in tutoring and other activities after school until their parents get off work and can pick them up. We do have some school-age children who are in childcare, but we supplement what we can do for working parents with these after-school programs and activities that we have awarded TANF subgrants to. Once we sort out exactly how much unallocated TANF funding we have, and we're very close to that point because we're finalizing all of the subgrants and they will become operational hopefully by early February. That's what we're targeting. We will then look at what we can do with increasing the use of TANF funds for something called direct assistance for childcare. Now, I want to be very candid with you and say we've never done that in Mississippi. We have never done direct assistance with TANF funds for childcare. And the reason we haven't is because we have always had plenty of capacity, or at least sufficient capacity, with our CCDF federal grant. We got out ahead of our skis, so to speak, because I made a decision as executive director that while we had ARPA funds available, that we were going to fund certificates with it. And we hit a shortfall as soon as those ARPA funds expired. We will begin exploring TANF direct assistance, and I will be the first to say that is something we don't have any expertise in at this point. We are talking to states that are doing that. We're talking to other states who have done that. You have to be very careful. I think all of you would understand I want more than anybody to be very careful about how I allocate a single TANF dollar. I don't want to be having to explain allegations of misallocation of TANF dollars. So I'm going to be very careful and very deliberate, and maybe slower than some folks would like me to be, about negotiating the TANF direct assistance version of childcare. I don't know how much we can do. I don't know how many families we can assist in that way. But I do believe I'm correct in saying that to qualify for the direct assistance, essentially the families have to qualify for TANF in the first instance. And while there may be a much larger population that qualifies for TANF than what is actually enrolled in TANF at this time, which is about 4,000 people. We can't presume that they qualify for TANF until we do the eligibility determination. So we're going to proceed forward on that front slowly, carefully, deliberately to make sure we do it right. And we will continue to look at other options. There are a couple of other things that I think would help. You know, in the best case, if we funded every family, every child who was eligible for a certificate, that wouldn't solve the child care need issue across the state of Mississippi. And if we were back at 36,000 children tomorrow, there would still be families all across the state who need child care. And so some of the other things that we're looking at, and I believe there are some legislative proposals that have been introduced or that will be coming before you. Some of the other things are this legislature passed a child care tax credit a couple of years ago, I believe it was. Nobody's used that yet. One of the reasons we think it has not been used is that the threshold is set at about $6,000. And if we drop it back down to $3,000, maybe employers will be more inclined to take advantage of the child care tax credit. I'm not sure. I'm just telling you, those are some possibilities. And we are routinely talking with large employers, offering our technical assistance. We have a significant amount of technical assistance and expertise in childcare, and we sit down with large employers regularly and talk to them about the possibility of their doing something like what the Toyota plant at Blue Springs has done, and that is raising up their own childcare presence near their plant, and using childcare like any other employee benefit to support employee recruitment and to support employee retention. Some employers are interested in that. A lot of employers have no interest in getting into the childcare business. There's a lot of liability and risk involved in being in childcare, and some employers just say, not for us. We don't want to do it. But we continue to have those conversations. We've talked with, folks from Ingalls Shipyard and a number of other large employers who are thinking about it. And we have a regular dialogue with the Mississippi Economic Council. They are helping us to promote the child care tax credit. And we are preparing kind of a workbook for them to talk to employers about what it would look like to take advantage of the tax credit or to be involved directly in child care. Those are, I'm leaving anything out. I think that's about what we're doing right now in regard to child care. We're trying to look at every option. We're trying to do as much with every dollar that the legislature has given us. And we're trying to look at ways that we can use dollars that we have on hand, use it properly in order to, again, help families with child care. Mr. Chairman, that's kind of the thumbnail sketch of where we are with child care. I'll certainly try to answer any of your questions.
What is the difference between the voucher and the direct payment in terms of the mechanics of how the money flows?
Really not much at all. I mean, if we do direct assistance, well, let me back up and say the certificates that we've been talking about, they're awarded for a child, but the payment goes directly to the child care provider. The payment never goes to the child's parent. It goes directly to the child care provider. Somewhat similar to what I know this committee is familiar with, how we reimburse healthcare providers. Somebody gets treatment, they're eligible for Medicaid, the payment is made to the provider. It's not made to the patient who received the care. And that's how our child care certificate program works. If we did direct assistance with TANF dollars, we would replicate the the child care payment program is the certificate program. We would just replicate it and it would look the same. The only difference would be that the funding would be TANF funds. Just like right now, we're funding some certificates directly with general fund money that this legislature gave us for the current fiscal year. We're using the exact same model. We award a certificate once we receive an application and we make a determination that that family qualifies under the eligibility standard, which is 85% of the state median wage. That is the level at which a family qualifies. I think it's about 68,000 or 70,000 for a family of three right now is what, those are the families that qualify for a certificate.
Well, I'm still confused under if I'm using the term correctly, the direct pay grant or the direct grant, do the funds go to the individual or do they go to the healthcare provider?
They will go to the child care provider, Mr. Chairman, just like they do right now. There will not be a direct payment to a parent in any form of this. It will go directly to the child care provider. And the reason for that is, well, certainly the recent news should make it very clear. We want to make sure that the provider is receiving payment for a child who's actually receiving child care from that child care provider. We have requirements of attendance and records that have to be submitted in order to be reimbursed. And our internal controls for our child care payment program, I would compare favorably to everything that Washington has been asking other states to provide evidence that they are policing, so to speak, their child care program. We put in place internal controls, and the money is allocated for the benefit of the child and the family, but it is paid directly to the child care provider.
Well, I want to be clear. I'm just trying to understand this and get information for myself. But having heard you explain the two different programs, they seem to me like they're the same thing.
They are the same thing. They're just funded differently. We can't put more TANF money than what we're currently allocating to the CCDF program, but we can possibly use TANF money for a separate certificate program.
Well,
Have to operate separately.
Maybe I'm missing something, but I understood you to say that there was difficulty in setting up this other program and we'd never done this before. And it was sort of like we were building something from the ground up, but it seems almost a situation where you would take whatever you have now and get out some liquid paper and cover up one word and write in another word on the form and it'd be good to go. I'm guessing it's not quite that simple.
Not quite that simple in the sense that, one, we've never applied the TANF eligibility criteria to CCPP, to the child care payment program. And we've never done direct child care funding with TANF money in this way. It looks like it would be real simple, but it's really not that simple because we have to be sure we identify the families as eligible and that the money is allocated pursuant to federal law. And
You
regulation.
can do all that, can't you?
Well, we certainly are going to try, Mr. Chairman.
If we get that new program up and going, how much of an impact will that have? And do you think that will get us back to the levels we had before the ARPA money ran out? Or do you think we'll still be below that level, even in the best case scenario?
Mr. Chairman, I wish I could tell you. I think my answer to that is that's a $30 million question. We don't know whether we can put $30 million in TANF funding into a direct assistance program or not. I don't know. Simply because I don't know how many people will apply who will be determined eligible under that different, slightly different model.
It seems to me, and I'm just trying to understand something that at least I've got enough sense to know I don't understand, but other than knowing I don't understand, I'm not sure I do a lot better than that. But my understanding from what you're telling us today is that more or less you're, apart from your concern about not misspending money and being careful and all of those concerns, you're moving as fast as you can to put as much money as you can into childcare voucher or into childcare. Is that sort
Yes,
of?
That's exactly what we're doing. And I realize it doesn't look fast enough to a lot of people, but we want to be completely consistent with federal requirements as we do this. And the last thing I want to do is create any kind of overpayment obligation on the part of this agency.
You somewhere in there, you mentioned the 1st of February. Do you remember that? You remember you said the 1st of February?
1st of February is when our new TANF subgrants will be operational. We're not going to be at,
No, that's closer than it used to be, you know.
yes, sir. We're not going to be into this direct assistance program by February 1st, if that's what you're asking me. We're not going to be there yet. No, sir.
When do you think we'll know more?
I can't predict. It depends on how soon we can develop and write we've got to write the standard operating procedures. We got to make sure we understand from states who are doing this, how to do it. And then what seems to be the most elusive piece of this right now is we need guidance from our federal oversight agency, and they've been a little bashful with guidance about everything of late. So that would be the Administration for Children and Families.
Is there anything the legislature can do to help you do this more quickly?
I can't think of
Other than sending random legislators over to help you with the paperwork day by day? Or not necessarily random. I think we could pick and choose the ones we'd like to send over to help you day to day.
Yeah.
But seriously, is there anything we can do?
I'm sure Dr. Allgood would love it if some of you want to come over and review.
We were not thinking,
applications,
we were not thinking it would be a situation where there were people that would want to come. I had in mind we would send people who didn't want to go, but that we thought would do better over there than over in this building.
Mr. Chairman, there's a reason why we chose the legislative branch.
But I'm not trying to be flip. If there's something we can do to speed this up, I think we'd all like to do that. I know others have questions. Senator Fillingham?
Thank you, Mr. Chairman. I was just curious if you're able to come up and make all the rules work to spend the 30 million or however many dollars as you've been describing. Is that extra money that we were not otherwise receiving? Or if not, what would we not be spending that money on if we in turn spend it on the childcare that we would have spent it on otherwise?
Well, it's TANF money, Senator, so we would be spending it on any of the legally authorized purposes under TANF, either family dynamics, keeping families together in their homes, preventing out of wedlock pregnancies, helping families get into the workplace, and helping families get education to be prepared for work. So we'd be using it for the TANF purposes otherwise, or we would be using it for subgrantees to provide those wraparound services that do those same things. Our subgrantees, I talked to some of those new subgrantees at some training last week, and I reminded them they're now part of our team. They're not subgrantees to do something that we aren't already legally obligated to do. They are simply helping the Department of Human Services accomplish the work that we should be accomplishing under TANF. So if we didn't use that money for childcare, we would devote it to helping families with all those other wraparound services.
Other questions? Senator Blunt?
Thank you, Mr. Chairman, and thank you, Mr. Anderson. I know you've worked hard on this and we've talked about it many times. I appreciate you being so responsive in your remarks today. I think I heard you say that your agency is seeing an increase in cost in administering the SNAP program as a result of a bill that was passed in Washington last summer. Do you have an idea of how much that is and how it's going to impact?
Yes, sir. The administrative cost, which we have put in our budget request for this year, will be approximately $15 million. And where that comes from is October 1st of this year, the SNAP program, which has always been a 50-50 proposition, 50% of the administrative costs funded by the feds and 50% funded by the state. That drops down to a 25% share by the federal government and a 75% share of the administrative costs by the state, effective October 1 of this year. We, based on our last 2 or 3 fiscal years, we spend about $60 million on administering the $800 million TANF program in Mississippi. So a fourth of that, which is the additional cost that we will be have the responsibility of funding come October 1st, is $15 million. And so it'll cost us an extra $15 million just to run the program come October 1st. Now, there's also a cost share piece, if you want me to address that as well, that comes into effect October 1st of 2027. And that's what many of you have heard already about payment error rates and everybody trying to get their payment error rate down to a lower level. The reason is there are 3 cost share tiers in HR 1. The first one is there actually are 4. If your error rate's below 6%, there is no cost share. The federal government will continue to fund your SNAP program 100%. If your error rate is between 6 and 8%, the state is required to pick up 5% of the programmatic cost of the SNAP program. For us, based on our historical amount, about $800 million, 5% would mean an additional $40 million for us to administer SNAP in Mississippi. If your error rate is between 8 and 10%, then the cost share for the state is 10%. And double the 40 million, that means if our error rate is between 8 and 10%, then our cost to administer the SNAP program would be an additional 80 million in general funds. And then if your error rate is above 10% come October 1st of 2027, then your cost share is 15% of the programmatic cost of the SNAP program. For us in Mississippi, that would equate to $120 million in general funds to continue to administer the SNAP program if we stay at the same enrollment that we have been at for the last 5 or 6 years that I've been executive director.
And so using those tiers and those estimates, historically, you think we may be in the $40 million annual range? Is that what I heard you said? Or maybe the 80 million? Can you give me an idea?
Senator, I wish I could tell you we were in one of the first 2 tiers. Currently our error rate is about 10.49%. So that would put us in the highest tier, the 15% tier. And if that program, if the programmatic cost share went into effect for us right now, it would be the $120 million amount. Now, we're not ignoring our error rate. We have about 3 pilot programs we're working with 3 different vendors And we're also working with two other vendors called Westat and Code for America, who are helping us get at the root cause of what our error rate is. I mean, what's causing it? And we know two of the primary factors are income verification, employment verification, and then thirdly, proper identification of the household size. Those are three of the primary errors, if you will, that show up in our error rate. And we're looking at, there are others though, that we have these two vendors who are helping us get a handle on that. And we're also looking at a model. What Georgia is doing right now, Georgia is using 3 income and employment verification vendors. And if the first 2 provide them with 90% or greater, what am I trying to say? Confidence level that they've got the number right, they don't go to the third one. The third one that I understand they're using is Equifax. Is kind of the last resort. They're looking at Equifax as their third round of income and employment verification. We have talked with the Legislative Budget Office about having a 3-tiered approach for us. I believe over in the House, Representative DeWeese is offering some legislation that would give us funding to do that. We had access for a short period of time to some income and employment verification. FNS was paying for it. When they quit paying for it, we didn't have the wherewithal to continue the service. So we are working on, and then we're working 3 pilot projects with 3 companies, who Promise, Truve, and Steady IQ, 3 companies who have various different models for how they do income and employment verification.
So I think I hear you say that as a result of that bill that was passed in next October, the state's cost would be an additional $135 million a year if error rates stay the same. And so it's probably worth spending a little bit amount of money to get you in that lower match category, to get, so you're not paying an additional 120 million, but you're trying to get that number down so you'll pay less money.
Absolutely, Senator. Yes, I think I would, and I will be talking to our budget committee in this House in about 10 days, I believe, or 8 days. And I'm going to be asking the legislature to invest in those income and employment verification tools as an investment against the reality of our having to have a cost share of 40, 80, or 120 million. And let me make clear, the way the federal statute locks in the error rate for the state at the end of this current federal fiscal year that ends September 30th of 2026. They gave states 2 options. You could use the error rate as of 9/30/25 or the error rate as of 9/30/26. So even though the cost piece doesn't go into effect until a year later, what our error rate is come October 1st of 2026 will determine what our cost share will be in October of 2027. That's why we're working so hard right now to get it down.
And I believe I believe Senator Fillingham had a bill that was intended to help with this, and it was a good bill. But I think there are additional state requirements that put additional work on you that you've recommended in the past to change. Is that still in place?
Yes, that's still in place.
Essentially additional bureaucracy than is required under the federal law, by state law.
By state law, there are some requirements that the feds do not require.
And all that is still in place, right?
That's still in place.
And you've supported making those changes in the past?
When I was permitted to talk to it, I have asked this legislature to make some changes.
Okay, thank you. I don't want to get you in trouble. And then finally, and I appreciate your patience, Mr. Chairman, the pool of money that comes to the state in the form of TANF, a portion of that is diverted to Child Protection Services to fund their agency budget. Is that right?
Well, we do well, let me put it this way. We do a $29 million sub-grant to CPS every year. I'm told that they use it for a number of things. They use it for investigative costs. They use it for social service specialist costs. And they may use it for some training, but they use it for operational costs. Is that a fair statement? I have one of the deputies out here. They use it for operational costs. Yes, sir.
So the state has chosen to allocate TANF money, which would be eligible for that second child care payment program that you've just described, to essentially fund what some people would argue the general fund should fund for the basic operations of the CPS agency. Is that what's happening?
Yes and no, Senator, because somebody reminded me recently, CPS exists to try to keep families together and reunify those families that are separated.
Right.
That is a permissible TANF use. Otherwise, we couldn't give them any of the money to begin with.
Right.
So that is a proper TANF use for those funds. Could it be funded with general fund money? Absolutely. But we, at this point in time, give that TANF funding to CPS with the hope that they can do what they're in existence to do. And that is to take care of foster children while they're in their care and to either put them into foster families or reunite them with their families in the course of their work.
And then they're responsible to make sure that that money complies with the federal law as it relates to TANF.
Absolutely.
Okay.
Every sub-grantee, including CPS, has the same requirements we have. They have to follow the federal law and use it in accordance with the TANF guidelines.
Thank you very much for your responses. Thank you. Thank you, Mr. Chairman.
If an applicant who is eligible for food stamps is denied eligibility, they don't get any food stamps, even though they're entitled to them, is that considered an error?
No, assuming we make the eligibility determination properly, it's not. But one of the other pieces of the payment error rate is agency error. That happens. I mean, we're not perfect by any means. And we make agency errors. We may stroke the wrong number. We may put the wrong name. We may put the wrong amount of income. And so those agency errors also contribute to the error rate. And there could be somebody who applied for SNAP who is actually eligible, but we made the wrong determination. I don't think we do that very often, but it does happen.
But is it considered an error if someone is entitled to food stamps but does not get them?
Well, let me say this, Mr. Chairman, we come behind ourselves. We have a SNAP quality control program where we pull a sample each month and check our homework, basically. If we made a wrong determination, we will reverse that case. And not only do we check our homework, FNS comes behind our quality control team and they pull a separate sample and they check what our SNAP quality control team has done. And they find from time to time that we've made an improper decision, that somebody was eligible and we found them not to be eligible, then their case is adjudicated in their favor. That happens.
But is that counted as an error in terms of determining the penalty?
Yes, sir. It would be initially counted as an error. Yes.
Other questions? Thank you for coming. We appreciate your working through all this with us.
Thank you, Mr. Chairman.
I would just say this about the big picture issue of childcare. There is always concern about people entering the workforce. There's much attention given to our workforce participation rate, generally accompanied by a misuse of the term workforce participation rate, but that's a separate rant. But for everyone that I know that has worked in the area of trying to get people into the workplace of all political types and persuasions, they say there is a fairly large group of people who want to work. It's not trouble to get them in the workplace. They want to workforce, but they have a child to take care of. They have an elderly parent to take care of. They don't have transportation. And yes, there's some people who can overcome those problems, but not everyone. And if you want to have an impact on the workforce participation rate, one of the major things you would do is focus on childcare and transportation and those sorts of things. And I'm not directing that to you so much as it directing it to all of us who are policymakers.
Mr. Chairman, I would remind this committee also that every family that receives a child care certificate from MDHS is a working family. That's that's a requirement of the program. Every family that receives a child care certificate, the parent in that family, whether it's a single or two parent household, they're required to be working at least 20 hours a week in order to 25 hours a week in order to keep their certificate. So, I mean, we support working families with this program.
Is there anything else? Senator Boyd was unable to make it here. We will take up her bill at a later meeting. If there's nothing else, is there a motion to rise and report? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have.